Let's do it. Welcome to the Women Inspired Podcast. I'm your host, April Seifert. There is nothing more powerful than a woman who is inspired to action, and that's my number one goal, to inspire you, my listeners, to take action in your lives. Each week, I get to interview some of the most inspiring women, and I'm bringing those interviews to you. Let's do it. Jennifer Schneider is the Chief Medical Officer for Livongo Health. Prior to joining Livongo, Jenny held several leadership roles at Castlight Health, most recently as Chief Medical Officer. She has held leadership roles in the provider setting. She's been a health services researcher and a chief resident at Stanford Hospital. She's practiced medicine as an attending physician at Stanford, the Palo Alto VA, and Kaiser Permanente. Jenny has an undergraduate degree from the College of the Holy Cross. She received her MD from Johns Hopkins School of Medicine and her MS in Health Services Research from Stanford University. And she completed her internal medicine residency at Stanford University Hospital. Jenny, welcome to the podcast.
Thank you, April. So excited to be able to join you.
So I gave everybody a little bit of a background on you, sort of the official bullet-pointed version, but I want to hear about you in your own words. So tell us about yourself a little bit.
Sure, absolutely. I can tell you about myself from my version or from my mom's version, either one.
Whichever one is better, whichever one's more interesting. That's what we want to hear.
Depends if I'm in trouble or not. So my background, so I'm an internal medicine doc with a master's in health services research. I grew up in Minnesota. I've been an avid athlete my entire life. I was diagnosed with type 1 diabetes when I was 12 years old, and that really was a big draw, a big push for me to get into healthcare and into medicine. I had a chance to go to Johns Hopkins Medical School, where I did most of my work was in international rotation, so a real love of international work and serving people who are underserved, as well as a lot of the exploration of the outdoors. I then did residency at Stanford in internal medicine and hung around to get a master's in health services research. So in many ways, I think my mom would say I'm a geeky doc who likes numbers. After that, I had the opportunity to join a company called Castlight Health, which really looked at creating a free market for people in healthcare by allowing people to understand what healthcare costs and how good your docs were before you actually got that healthcare. I subsequently moved over to a company called Livongo Health, where we're really revolutionizing the care for people with chronic conditions outside the world. And the reason I did that is from a personal standpoint. Again, I've had type 1 diabetes for 31 years. I just celebrated my diagnosis anniversary.
Wow.
And it's a driving motivator for me. I've done countless marathons, climbed Kilimanjaro, recently finished my first Ironman.
Yes!
All with this idea that
that's awesome. Sorry, I have to pause. Like, that is a huge accomplishment. I've been to a couple and watched and cheered friends on, and oh my God, that's so cool. Sorry, keep going.
Yeah, no, I have to say it was one of the best experiences I've ever had, mostly because it was fun to train for, fun to accomplish. The spirit of those is just outstanding, but also you're so deranged from a metabolic standpoint, both from your lack of hydration. You can start to feel your electrolytes going all wobbly, and it was really, really fun to get to experience that. But I really, for me, I'm really just motivated by, we all have our own unique challenges, and I think all of those challenges present interesting opportunities. I am very much like my own middle child, where whenever I see an obstacle, I actually look at it as a huge opportunity to overcome. So I don't do so well when things are easily paved. I do much better when I'm thrown a curveball every once in a while, because I get to think creatively about how to get around it or whack it out of the park. And so I've just generally lived my life that way. And I do think my own diagnosis with type 1 diabetes has been a large part of that.
That's phenomenal. And you're absolutely right. Each one of us has been dealt a hand of cards or a set of circumstances, some of which are very much beyond our control, but there are a couple of ways to look at them as a barrier or as a challenge to overcome. And that's a great mindset to cultivate, to look at them in a way as something that you can overcome or move forward in spite of, and to look for ways to not let that keep you from doing the things that you want to do. So we talked we talked a little bit about how you got started with your company. It's a really interesting and really important space right now. Talk a little bit about that company and what it's doing for the healthcare industry, and in particular, what it's doing for consumers, because I don't think that people quite realize that they are actually consumers within the healthcare industry.
So Livongo Health is approaching healthcare by putting the individual person, the member, the person with the disease at the center. And by that, I mean, so chronic conditions are things that those of us with chronic conditions do all the time. They're part of our life. We live with these conditions, whether it's hypertension, dyslipidemia, depression, diabetes. We're managing. And we're actually managing, 99.99% of the time without any healthcare providers. We may see a healthcare doc or a caregiver once every couple months, right? But the rest of the time we're doing this, and we're doing this minute by minute. And so Livongo's philosophy is really to say, let's empower those of us with chronic conditions to do it better. And we can do this really by taking data, collecting data about how we're doing in the outside world, and starting to encourage and nudge and reward behaviors that help us have better outcomes and make us feel better from a day-to-day example. So for an example, today in the diabetes space, Livongo Health is able to collect blood glucose values. And when we collect that reading, we can actually give instructions back to an individual, ways to help make them feel better. So if their blood sugar is a little bit elevated after lunch, we may recommend that they could actually, walk for 10 minutes and come back into range. And those nudges around, sort of keeping people in the range and doing that on a real-time basis is incredibly powerful. My draw to this space is actually, in the back of my mind, I had this hatching for a while, that there's just all this data that we collect in the outside world that we don't leverage. I had one episode where I had a low blood sugar reaction, but the kicker of it all was that everything was being monitored. I woke up, I was unconscious in my bed for the first time, and I saw paramedics standing over me.
Oh my
and my
gosh.
blood sugar was really low. But like I said, and frankly, at that point, I thought I had a stroke because they were asking me to move my limbs and speak, and I could not get words out. And so it was a very powerful moment for me. But the kicker of it all is that I actually wear a continuous glucose monitor and an insulin pump. So all that data was being recorded, but nobody was doing anything with it.
Oh my
so
gosh.
This idea that we're recording data outside the world for people with chronic conditions, but we're not leveraging it to do anything. So there's real opportunity across all chronic conditions to take that data, leverage it, and actually make it meaningful and actionable, not in like a global, comprehensive way, but like a bite-sized, step-by-step action that individual people can actually do things with it. So I love the concept. I love what we're doing within the space of chronic conditions. And we're seeing wonderful outcomes. But more importantly than that, people with chronic conditions love it. We're making people's lives better. And we see that and hear that testimonies every day. And it's just incredibly powerful and meaningful to get to be a part of a company that's doing that.
It's really cool to hear you talk about it in the way that you just did. A lot of the interviews that I've done on this podcast so far, many of them have come back to, actually, I interviewed a woman this morning and we talked about this very thing. It's so common for people who are very driven in whatever the career or job they're doing is. It's that the why behind what they're doing. There's something that is bigger than themselves, that's bigger than their paycheck. It's bigger than that one individual experience. And that big why is what's driving them and helping them push forward and gives you so much energy within the career that you've chosen. And I can totally hear that in your voice.
Yeah, I think that that's right. And I think that even more than that, all of my colleagues at Livongo are the same. And so to get to wake up and have the privilege of being able to do a job where you and the people with whom you're working are incredibly mission-driven is one of the biggest gifts that I've ever had. And I just feel so fortunate to be a part of this, part of the team, and part of the general mission within healthcare. And I about our company very big picture. Like, I believe that our country is at risk because healthcare costs continue to escalate. And the collective, we need to figure that out. And this is one way in which we can do that. And so, again, the mission is bigger and broader than growing the company or growing the finances. It's about helping people, but it's even more than that. It's about helping stabilize the country we live in so that the economic impact of healthcare that's spiraling out of control is stops. We need to all kind of think about that and work on that.
Totally agree. I've been in the healthcare industry for quite a while. My real job has been in data science within the healthcare industry. So this really hits very much on a space that I have quite a bit of experience in. And for people who aren't in the industry, I think this topic gets very focused on, it's timely right now because, a new administration has just come in to the White House, and people focus very much on what that single person in that office, the president, what they're doing, and what did our previous president do, and what did his act do, and what will this new administration do, and will they change it? And fundamentally, that does impact the nation, don't get me wrong, but there are so many other drivers and so many other motivators and catalysts within the healthcare industry that almost have nothing to do with what any one person in the White House or what they might do. It has nothing to do with that. It has to do with us as patients, as consumers, the decisions we make, the support we get in making those decisions, us realizing that we do have an extremely important role, and we should be given the tools and technology to be able to play our role really well. And it's something that I hope if people are, as people are listening to this episode, that you take away that you personally have a very important role. And it's not to say you shouldn't go to the doctor, you're spending too much money. No. It's to say your health is very important and your experience is really important. And if we're taking care of that, a lot of these other pieces start to fall in line. There's more complicated, pieces outside of that, but there's a huge part of it that we all have to play.
Yeah, no, I couldn't agree more. I mean, I think that the world in which healthcare and medicine has kind of been born or structured was very hierarchical, where like the doctor says this, the patient does X, and they lived in divorced worlds, which is we're all responsible for our own health, right? And we can build tools and technology to allow us to be better at it. We've done that in every other industry, right? Take, for example, travel, where you used to have to rely on the travel agents, right, to get book your tickets or find the right times to work in your schedule. Now we've enabled individual people to be able to do that and optimize that for their own conditions, their own selves, their own lives. Why we're not doing that in healthcare, or why we're starting to do that in healthcare now is very important and very obvious. We just need to take those steps and do that faster and better. And that's exactly the stance. And so I say all the time, I'm a doc and we're betting on the people. We're betting on individual people to better, not dismissing docs at all, part of the ecosystem. But we're not betting on the docs, fundamentally. We're betting on people. And so want to empower those people to be able to do that in conjunction with their care providers, but really putting the person at the center, not the healthcare system at the center.
Awesome. I want to change gears just a little bit and talk about your own personal experience. Chief Medical Officer is a pretty lofty title. Tell me a little bit about your career journey. So you mentioned that you are a physician. Did you practice? How did that journey work out for you?
Sure, absolutely. Well, and I giggle all the time, right? So CMO really, I think, stands for Chief Make It Up Officer, and fill in the M. There's lots of M's there. But yeah, my own personal journey is that again, I was diagnosed with type 1 diabetes when I was 12, which was the impetus and desire to go to medical school. So I went to Johns Hopkins for medical school, really fell in love with pediatric infectious diseases. At the end of the day, decided I liked kids more than I liked kids' parents, and so but loved complexity. And so chose an internal medicine residency path. I went to Stanford where I did my res internal medicine, and I hung around and did what's called a chief year, which is really just a junior faculty, totally underpaid, high workload, but you get to sit in lots of interesting conversations year, which I loved. I actually had a fellowship in infectious disease lined up, and at the last minute decided that felt too narrow for me in terms of what the work I would be able to do, that I was a broader thinker, and so had an opportunity to do a master's in health services research and health policy at Stanford, and grabbed that opportunity. And that's where I got to learn about how to think about data on a large scale. So really meta-analyses, large database questions, comparative effectiveness, cost effectiveness to help drive overall healthcare decisions. At that time, I had an opportunity to do some consulting for a company was then called Maria Health. And the proposition was they were trying to create a free healthcare market. So again, making cost and quality transparent to individual people. And that felt amazing. The driver there is I had just sort of been tired of my friends complaining about spending $40 to go see a specialist doctor while they had no problem dropping $300 at their hair appointment. And I kept thinking, you have no idea how much debt I've accrued. And your hair cutter hasn't even graduated from high school yet makes so much more money. And that seems reasonable to you. That there was this, bizarre perception of healthcare and the value associated with healthcare. So loved the concept around creating a free market, in part to help drive healthcare choices for individuals. So joined, was then Maria Health, then subsequently became Castlight Health. Knew nothing about technology, but learned a ton on the ground, joined, helped build the clinical product, started and led the analytics team, and then served as chief medical officer. Before transitioning over to Livongo, we've had the chance to talk about that, but Livongo to me has been a career high point in many different aspects, but mostly because chronic conditions are a huge driver for us across healthcare system. Now, it may not be as sexy as a Zika virus outbreak per se, referencing my old infectious disease world, but it's real, and it's big, and it's a gnarly problem, and it involves lots of different stakeholders. And so what drew me into internal medicine is drawing me, I think, into this space as well.
I just want to point out that you just used the word Zika and sexy in the same sentence, and I have never heard that before. So today, officially, you take the cake for that one. That was great.
That's great.
So you talked about when you joined Castlight, though, not having any technology experience. What was that like? How did you feel confident? How did you do that when you didn't have a strong background in the area? Like, they are a technology company. So how did you get yourself to do that if you didn't have that background?
It's a great question, and it's one that I see a lot of people wanting to cross over from healthcare into technology now. I spend a lot of time with healthcare professionals training, and I think that the answer there is anyone who is drawn to solve a problem and has a curiosity and an eagerness to learn how to do that can work and collaborate efficiently. I see a lot of people both on the tech side and people in healthcare that don't do well sort of coming together. Tech I know the answer. I've done this in social media. It's the same for healthcare. For an example, we'll just tell the healthcare insurance companies what to do. And you think, okay, awesome. Totally not going to work, right? And the flip is people coming out of healthcare, I'm an attending, I'm used to telling the team what to do, and then they go do it. Awesome. Again, not going to work in healthcare technology. So this idea of being able to marry those two disciplines together effectively is one that a lot of people have not succeeded at. We've seen a lot of companies come and go. But I think fundamentally, and where Livongo is really well positioned, is taking the best of both worlds and finding specific individuals who are open and curious and eager and learn from one another, right, to fix and come to an optimal solution. That the skill set there is not expertise in any one domain. It's really this ability to be creative and to think flexibly around identifying what the problem is, and then creatively solving for that problem.
Makes total sense. So your career journey, as you've described it thus far, it feels very linear, like it makes sense. You had moves that seemed to build off of each other and make sense, and it all feels very straightforward. But I don't know that any of us have actually had an experience like that. Did you ever hit a roadblock, a low point, a barrier during that journey? And can you talk about that a little bit?
Yeah, it's a great question. I think it's hard for me to feel like I've hit a low point. I would say I don't feel like my career path has been linear by any stretch of the imagination. I think, to this day, my mom keeps asking me, like, do you still see patients? Like, do you still have a white coat? Because that's her vision of, like, what her daughter, the doctor, must do. And it is true that I do see patients. It is not what I do on a regular basis, but she still continues to harbor that belief because that's the context that she understands. Rather than a career path, and I didn't say I want to set out to be X, Y, or Z. I'm much more motivated by interesting questions that float across my desk and then take full advantage of that. So is there some, vulnerability associated with that? Absolutely, right? To take a pay cut of greater than 50%, moving from clinical medicine to something that was more intellectually intriguing, there was definitely some vulnerability in that. But at the end of the day, I'm not motivated by money. I'm really just motivated by doing interesting work to solve interesting problems. And so keeping open that radar to see what's out in the ecosystem, and what are the interesting questions that are being raised, and how can I, Jenny, uniquely contribute to that is, I think, the biggest driving factor for me.
As you've been given these really interesting questions and new things have floated across your desk and you've been making these moves, how have you focused on continuing to grow and continuing to expand yourself and your capabilities to be able to meet those challenges? I think it's really important. Sometimes people get into their careers and they think, great, I went to school, I'm now an accountant, I know how to do accounting, and I'm going to do that for the rest of my career. I think it's a really dangerous thing to do, to come in with a skill set and then let it hang out there. So how have you kept yourself growing and I don't want to say relevant, but really just kept developing yourself? How have you done that?
Yeah, I think that's a really great question. And so, for example, when I moved from Castlight to Livongo Health, the conversations that I had with our CEO were really around, I know the skill set that I bring, and you need this skill set within your organization, and I can do that. I know that I can do that. But what I want and what I need in this role is the opportunity to expand and develop in the following areas where I haven't had exposure, and I haven't I don't have the confidence that I could successfully do that today. And having that frank conversation as I took the role, which with the expectation that I was going to execute on the same areas that I had executed, agree upon, even before I start, that I had this opportunity to do and learn and grow in different areas. And that to me is so fundamental, to have that conversation within the context of where you're working, but also within the context of my team, right? And so I hire people to do specific jobs, but I always have conversations around, what are your aspirations? Where do you want to grow that you don't feel confident? I think it's a little bit around the discipline of how you live your life. And as soon as I feel like I'm not nervous anymore, I know I need to change that up, right? So nice. A great example for me is when I was first at Castlight, I did a lot of public speaking as chief medical officer. And I used to have a fair amount of anxiety about getting up on stage and doing that, almost to the point where I would take little beta blockers to slow my heart rate when I speak. And then after a while, I stopped getting nervous, and that's when I understood, okay, that's great. Now I'm not perfect in there. I have to learn for sure, but I'm no longer nervous, and so I need to put myself in something maybe tangential, maybe completely orthogonal, where I'm nervous, where I feel like I'm nervous. And that is the nervousness. That's for me the gauge of when I'm trying something new or trying something outside of my bounds and stretching myself. Now, that isn't every single day of every single minute that I feel that. I still need to continue to build on those areas where I'm not nervous, yet still not perfect. And so I understand that. But to make sure that every time I'm in a role or a position or contribution, whether that's athletic, whether that's being a parent, whether that's as a job, that there's something that's unknown that makes me a little nervous, has always been a drive for me. I'm pushing myself in different boundaries.
It's a cool thing to call out, because sometimes I think it's easy to look at people who are doing things that would make other people nervous or afraid, and think that there's an absence of fear there. And in fact, for so many people, and I've heard it a lot of times, it's not that you aren't afraid. It's not that you don't feel that nervousness. It's that you're doing it anyway, in spite of the fact that you feel that way. Or maybe in your case, because you feel that way. That's something that motivates you.
Yeah, I think that's exactly right. In fact, one of our marketing people at Livongo said, I just thought that you understood this. I had no idea that you were nervous. And I was like, oh no, I'm definitely nervous, right? It's like, have I overacted to convince you too? But again, it's that, and you see that. I have young children, and you see that in young children, how they approach new experiences with, awe and skepticism and hesitancy, and how beautifully rewarding those new experiences are, because that's how they approach that. And to be able to cultivate that as an adult and seek that out and craft what those are, I think is a key to, at least for me, to both pushing boundaries, but also just for fulfillment and enjoyment in day-to-day execution.
So we've talked a lot about where you've been in your career and some of the things that you've accomplished, but what's next for you? What's your big, hairy goal right now that you are working toward in, I don't know, some foreseeable amount of time in the future?
I have lots of small personal goals when it comes to career, but where from an organizational standpoint, I just believe so strongly in this model where you take data collected outside the doctor's office and use the data with the rule sets to then motivate individual people to change their behavior around their chronic condition. That today we're in diabetes, and, if I had my way, by the end of this month, which is, I think, only a few more days, we'd be in 4 more other chronic conditions, and really kind of taking that model and extending that. So I'm spending a lot of time thinking through what our strategies are to expand into other adjacent and non-adjacent chronic conditions with the model that the healthcare system can evolve, because we have all this great data that we use and collect for people, but we haven't optimized its utilization because it's been very dichotomized between providers and individual members or people with chronic conditions. But again, really expanding across the platform for chronic conditions is where I'm spending a lot of time and a ton of energy. And hopefully you can tell the excitement in my voice about that as I think about healthcare and where we can go within healthcare.
We need people like you in healthcare who are so excited and mission driven and really, thinking in an innovative way, because again, when I think about the conversations that I've had with friends and family and people who don't spend a ton of time in the industry, they think about healthcare as health insurance, I think part of that is because of the way that it's been portrayed again in the political realm. Do you have healthcare? That means, do you have health insurance? And so it's gotten very muddled. But the fact of the matter is, again, it's so much more broad than that, and the impact of it is on real people, on their lives, on their health, on how they feel every day, how long they get to be here in some cases, in a lot of cases. And it's such important work. So we need people like you who are coming in really excited and thinking in an innovative way, because we're not going to fix the issues in the healthcare system, and we're not going to move forward with it and make improvements by doing the same things that we've done in the past, by not learning from other countries, other industries, other areas and people. We're just not going to do it by doing the same things that we've done for decades now. It hasn't worked. We need to do something new. So I think it's awesome the way that you're coming in with this very innovative approach and doing what you can with your knowledge and your training and your gifts to push the industry in a new direction. That's so cool.
Well, April, I love the way you phrase that, and thank you. And there's so many other individuals within healthcare doing this. It's a very exciting time to be in healthcare. And one of the sayings that our CEO tends to say fairly frequently is innovation starts by trying something new, right? Which seems very obvious and very simple, yet often we don't do that. And so, again, some of these ideas will work, some of these ideas won't work, but collectively we need to be trying a whole host of them. And so it's just an incredibly exciting field to be a part of. Lots of smart people from different disciplines asking questions and trying new things. And it's inspiring to be surrounded by so many other smart colleagues, other companies addressing similar and different issues in unique ways. It is a fun place to be, and I think an important place to continue to develop.
So thinking back on your career journey, your training, the things that you have accomplished, all of that, what advice do you have for other women that they might be able to take action on or apply in their own lives?
It's a great question. I think just don't doubt yourself. Just don't doubt yourself. When there's something you think or believe or intuit, and I find women to be so highly intuitive that's right and new and novel, just pursue it, and pursue it completely unapologetically. Just do it. Just get up and try, and be okay to make mistakes. But learn, make mistakes, fail fast, and learn from that, and get back up and try the next thing. And we have such a short amount of time on this planet that just pursue what it is that is most exciting to you, whatever that thing may be.
I want everybody who's listening to this to just take in, there's been a few times during this interview that you can just feel energy coming from your voice. You can just feel it. And I think that has so much to do with you being in a place where you get to make a contribution and do innovative things and be able to try new things. And like you said, fail. Maybe you're not going to do everything perfectly. And a lot of people aren't in that position where they have a job where they feel like they can make a mistake or they can fail and learn from it. A lot of people aren't in jobs where they feel like they can make a suggestion or try something new. More so it's a hierarchical organization where things are dictated down to them and they're told what to do. So if you're in that position, I would just encourage you to hit the rewind button, listen to the energy in Jenny's voice, and think about whether there are steps that you can take to start moving your day-to-day life in that direction, in a direction where maybe you can't switch jobs, that's fine, but is there something that you can add to your life or a way that you can make a change where you start to feel that passion and feel that momentum and energy coming from that thing that you are so driven to do, and a place where you can make a contribution, because it's a fundamentally different experience to slog through your day serving someone else and not making an honest contribution versus being able to, even if it's a tiny portion of your day, knowing that you made a great contribution and that you did something, the energy you get from that is so fundamentally different. So I hope everybody can hear that, because I'm over here just like cheering. I'm so excited.
I love that. I think that's a really great point, April. So one of the things I say, I have 2 girls and a boy. They're 6. My oldest girl is 7, middle girl is 6, and my youngest is a boy, and he's 4. And one of the things I say to them every day is that we don't use the word can't in our household. We only use the word can. Now, that doesn't mean that there are things that we're not allowed to do everything, but we have that fundamental belief that we can do anything. And so I think it starts with just the insight and knowledge and motivation that you're in control of your life and you can do it. You can do it. So get the negative part out and believe in the positive.
So awesome. The last question that I have for you is one that I ask everybody. We are compiling a power playlist on Spotify. This is a playlist of motivational songs to get people excited and get their energy up and get them in the right place to go out and do all these awesome things that they want to do. So all of these songs are curated by people who are guests on the podcast, and I have to ask for your contribution to our playlist.
I love the question, and I love getting to listen to all the other contributors. And my song is "Gonna Build a Mountain," and one of the artists that sings that is Sammy Davis.
Nice.
And the first lyrics are things that I repeat in my head often, and it's like, "Gonna build a mountain from a little hill," meaning like I'm gonna make something really big out of something really small, and I can do that. And so that's my song contribution, and I hope that people enjoy that.
I love it. Thank you so much. It is such a cool, as I'm seeing this playlist come together, it gets cooler every single week. It just has turned into this awesome thing. I have to thank you so much for taking time. You obviously are a very busy person with a very full career, so I so appreciate you taking time today to sit down and share your experience and share your story and just be so open about the path that you've taken and sharing what you've learned with other people. It's so important that something that I'm very passionate about and very committed to doing is, once I've figured something out or once I've done the work of slogging through the beginning and the hard part, I want to be able to make that easier for other people and share it with other people. So I so appreciate that you are willing to do that and share your experiences and your learnings with everyone else. So I so appreciate you being here today.
Well, April, thank you so much for the opportunity, and thank you for the work that you're doing and inspiring those of us that get to listen to your podcast. I really appreciate that.
I really hope you enjoyed this interview with Jennifer Schneider of Livongo Health. What struck me about our conversation is the passion and energy you can hear in her voice. She truly cares about the work that she's doing, and it comes through in the way that she talks about it. I was really struck by her comment about obstacles being opportunities and approaching new experiences with a feeling of awe. That's just an amazing way to approach life. Now, if you're enjoying this podcast, I would really appreciate it if you would share it with other people. The more women I speak with during these interviews, the more passionate I am about getting their stories out there more broadly, and sharing them with others helps me do that. Also, if you have a moment, if you could leave me a rating and a review on iTunes or wherever it is you get your podcasts, I would really appreciate that as well. It is my absolute honor to bring these inspiring stories to you, and as always, have an inspiring week.